Good day, all, and welcome to the Teledigm Pulse podcast, your rural health matters resource. Hear from your colleagues and industry experts on rural health issues and innovative care models that make a difference for rural hospitals, providers, and communities.
Well, Shane, today we have a guest on who's going to talk to us about a service that is relatively new in the telemedicine world, but not something unheard of, and it's rapidly growing. So, I think it's going to be a really good discussion today.
Oh, certainly. I got to tell you, this is an exciting one. I mean, all of our podcasts are exciting, but this one is a top notch podcast we have for you today, for a couple of reasons. One, it's an exciting topic around virtual nursing, and then two, and more importantly, our guest, which is Angel Bozard. And I got to tell you, I've known Angel for a while now, and it's fantastic. And I'm excited, Angel, that you've agreed to participate with us today on our humble podcast. And why don't we start, Angel, with maybe a little bit of an introduction and a background on you and VirtuALLY.
Sure, that sounds great. Thank you so much today for having me. This is exciting. I love partnering with you guys. About myself a little bit, Angel Bozard. I've been an RN now for about 20 years. My background's in mostly women's and children's, but I've done some med surg and kind of a little bit of everything all around. I have certifications in nurse executive, so I have my CENP as well as my newly deserved recognized Cavern certification. So that is a actual virtual registered nurse certification that's pretty new out in the world. So that's really exciting to kind of talk about. Maybe we can get into that in a little bit. But yes, I started with the virtual nursing program at VirtuALLY about a year and a half ago. It's been a wild ride. We've seen lots of success. We also do virtual sitting here with VirtuALLY. And what brought me into this particular business is during one of my clinic stints when I was doing MFM clinic, we used telemedicine pre-pandemic in order to serve some rural communities in Georgia and South Carolina. And that kind of started my desire, my passion project for telehealth.
Well, that's great. That's great. And I can't emphasize as a nurse, I'm a nurse and long clinical background. And, I'm often asked, are we going to build out our own virtual nursing team and program, and really trying to find a strong partner to do this with and alongside. Definitely became clear that partnering with VirtuALLY on this front was the way to go. So excited to extend this partnership out to our clients and future clients, as this service is in high demand and in high need, and which is why we're here today, to kind of talk a little bit more about that and why we had interest in virtual nursing programs. And and as you mentioned, it's relatively new, and it is, and in the rural markets, virtually brand new. Exactly. By and large.
Exactly.
The genesis of this was in a lot of the larger systems, generally inbred, using their own teams, their own nursing staffs, and they may be servicing some rural hospitals that they own or around their area. But by and large, very new in this space. And so the ability to bring this level of expertise to our rural hospitals and support the nursing side of the equation, we felt was very important. And the genesis of this really gets back at the core of what we do at Teledigm in terms of building programs that keep patients locally. One of the things we started to hear post-pandemic especially was the ability to recruit nurses, to have boots on the ground nurses that had a lot of experience with a strong skill set and confidence and competence. There was a struggle, and hasn't really resolved for the most part. And so what we started to see was an increase in transfers, despite offering a lot of different services. Between the nursing staff and the attending providers, just the comfortability with those subsets of patients became more and more difficult when your experience level drops off. And so we really felt we had to find a way to try and address this, to help these communities not only keep and retain nurses, but have the confidence of taking care of more patients there. And we're going to talk about that today. So Angel, how about we start with maybe an explanation? When you say virtual nursing, I mean, this is somewhat ambiguous, right? When somebody hears that for the first time, but maybe give us your perspective on that. What do you mean by virtual nursing?
Yeah, I think there's two different parts to that, right? So there's the technology, the definition side of it, if you were to Google it, right? So it's basically to provide care to patients using technologies such as video conferencing, much like we are talking right now. And that way you can better serve patients all over. But for us, it's more of the evolution of healthcare, right? So we're just unable at the bedside to provide the support and the time needed to optimize healing at the bedside without more resources. And so virtual care is a way that we can provide better health care to our patients and reduce the burnout and administrative burden for the frontline staff. And so at the end of the day, I would oversimplify this to say we are a resource for the bedside team to help patients in any way we can.
Yeah. And I can't emphasize enough, I'd agree with that in terms of you being a resource. And maybe, give me your perspective on, as a bedside nurse and having been there, done that,
Mm-hmm.
and this service is potentially available to you. How, when you say could be a resource, give me some examples of how you could be a resource for me. I needed a lot of resources. So I could probably use this, you're right. But tell me, help me try and paint a picture for me. What would this look
Sure.
like? How could you help me?
Absolutely. And I can start with some kind of simple details of what we do every day that helps the frontline staff. Let's say admissions, for example. So as you know, to go in and get an admission, it's tough on a nurse. Typically they already have 5, 6 patients. They've just discharged patients. They're already in a time deficit. And then they get the admission that comes up, right? The dreaded admission. And so what they do is they alert our team to, hey, I have an admission in room so-and-so, Mr. Jones needs to be admitted. And my team goes in and they do the full admission for them to include a handoff note just saying what's going on with that patient. Everything's documented in real time. So it's completely done. So it gives that hour back to that bedside nurse that they wouldn't have otherwise, right? So they can actually go and do their hands-on care to their other team members, their patients, as well as kind of catch up for the day. They can take their breaks, they can take their lunch, they can get out at a reasonable time without increasing overtime for them. And same thing with discharges, patient education. They know it's done, they know it's done exceptionally well. And the thing about the VRNs is it's very highly focused care, right? So much like you and I are looking at each other, we're focused in on each other, we're focused in on this conversation. This is what the VRNs can do versus as a bedside nurse, and I can speak for myself, and I'm sure 100% of the bedside nurses out there, there's always somebody waiting for you, right? Somebody's always pulling on you. You need to go do orders. You need to go do X, Y, Z. So you really can't provide that focused care to your patient as much as you would like to. And this just makes sure that they have that dedicated, patients have that dedicated care that they need and deserve.
Yeah. Yeah. No, I can't agree more. And the beauty of this model, as I see it, in working with you on the development of this program, is the ability to bring a lot of different subsets of expertise to the table that you can't get otherwise. You can't hire all of the staff that you would need to hire to cover all the bases. So, and this is an often asked question, and particularly in the rural hospitals, is, well, this is great, Shane. You have this med surg nurse there, but we have a critical care issue, or we have a pediatric issue, or we have, this issue. And, maybe my nursing staff has expertise in one area, but not all of them. So maybe explain how you can augment that from a lot of different angles and pull from different resources, expertise resources, if you will, to facilitate helping that nurse out.
For sure. We have a fleet of nurses that have very different backgrounds, right? So we have critical care nurses, emergency room nurses, OB nurses, baby nurses, pediatric nurses, PICU nurses. We just have a fleet of expertise available. So to where other programs, you may only have that one nurse available to you that would have that one subset of skills. If, say, you had a peds patient, you were in a rural hospital, peds patient came in, and it just didn't seem right. It wasn't something you normally see before. You could always pull in one of our VRNs, and they can walk through that patient with you. One, it really it adds the confidence to the bedside nurse, but also increases their skill set while they're learning, right? So they're learning a whole new way to look at a patient. Maybe they didn't know something before. And that ties really well into the mentorship, which we're all very passionate about. We know that our bedside nurses do not have the same level and years of expertise as they once did. And so, with that, somebody has to teach them, right? Somebody has to guide the way. And the VRN is a perfect way to just phone a friend, have them come in, be your second set of eyes, teach you maybe about a procedure you haven't done or haven't done since nursing school. Maybe it's a medication question you have. It's just a variety of use cases to be able to pull in that expertise from a whole different part of the country that you may not have available to you in your setting.
Yeah, for sure. And I have to think that, you mentioned the mentoring, which is huge. And I got to tell you that although it's relatively anecdotal in terms of what this is looking like downstream in terms of how you really quantify mentoring, right? But I have to think and imagine that if you are a nurse providing care and we can provide this resource to you in real time, along with the, call it what you want. You can call it mentoring and maybe you don't call it mentoring, but there's a de facto mentoring capability built into this nonetheless. And I think that it does. I can't imagine that a nurse dealing with these nurses in a collaborative fashion doesn't elevate their game and increases their experience and their knowledge base in real time, that the next time that scenario comes around, they're going to be better prepared to handle it versus traditional mentoring models, which is you just can't have your mentor hanging over your shoulder 24 hours a day. I mean, unless you need constant remedial training, which maybe I was one of those guys. I don't know about that, but I need a lot of remedial training in a lot of other areas too. But at any rate, it's I do think it's a fantastic option for that. And I know that one of the things that we hear from a lot of our hospital partners is really struggling to get nurses experience. And we definitely hear from the nursing staff's reluctancy and hesitancy as it relates to certain subsets of patients that they've never seen before. And the ability to offer these nurses in real time to augment that is a big deal.
Yeah, I think it's real time, and also it's a judgment-free zone, right? So they can take the technology into wherever and talk it through. I mean, personal story, when I first started nursing school, I was in a med surg unit, and all of my church nurses were eat your young kind of folks. So last thing I wanted to do was go ask them a question, right? Like they were going to just be like, why don't you know this? And, da, 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 da. And that leads to med errors. It leads to patient safety issues. So that's what we don't want. And that's the kind of problem we're going to get into, is because these nursing students fresh out of nursing school have these very high ratios and they can't know everything off the bat. I mean, it's taken us 20 years to get to know what we know now, and it's probably a fraction of what we could know, right? So we just want to make sure that we do that in a non-judgmental way. And that's one thing I can say about our team is they are nurses. They want to take care of the nurses just as much as they want to take care of the patients. And that's really important for a VRN. It's not just a matter that you're coming to work every day and you're taking care of X amount of patients. You really have to look at what that nurse is going through throughout the day to be able to help support her, or them, I should say, and to make sure when they leave, they're leaving in a way they want to come back the next day, and you can help them take care of the patients just as well. So that's something that we focus in on quite a bit, is the website manner of not only for the patients but for the staff. So
for sure.
Yep.
For sure. And that's a huge start. When it comes to that, you mentioned judgment-free zone, and you get in front of a group of nurses. You've been there, you've done this, right? You get in front of a group of nurses, and they come into the room, and I've been in these situations where you're ready to talk to them about a new project or a program, and they come in with their arms crossed, kind of slouched in the chair, frown on their face. In some cases, other, quiet, profanity laden types of things to their friends. And at the end of the day, our nursing staffs oftentimes have had things rammed down their throat for so long that they're a little jaded in certain instances. Not all of them, but some of them are. So help me understand when because I agree with you. A couple of things I appreciate. One is you mentioned you're a nurse's nurse, which is absolutely, I can't agree more. And I've seen it in action. But how do you get that over the hump? The change management process at the start of this type of program is critical. But how do you take a group of apprehensive nurses and try and articulate this is a judgment-free zone, we're a nurse's nurse, and how do you get beyond, yeah, right. We were told that by X, Y, and Z, and this is what happened. And so they revert back.
Piloted 10 different things, and we're
Lots
back
of
to square one.
post-traumatic stress or a lot of different issues. But how do you overcome that?
Yeah, so I think that starts with conversations of how we can help them, right? So you go in, we are your ally. We are here to support you. We're not here to take your job. So we have to kind of demystify virtual care to begin with, what it is and what it isn't. So typically kind of the barriers when you go in is they're thinking, one, you're going to try to take my job. Or two, now my nursing ratios are going to be increased, but I'm still not getting the hands-on I need, right? And so once you kind of demystify that and you let them know and show them these are the things we can do. We can do exceptionally well. This is the data we have behind it. This is the time we give back to you. So once again, you can take that lunch break. You can make sure you get out on time and that you're happy when you leave. I think that starts it, but really those first interactions with a virtual nurse are so important. So we go to the staff meetings, we go to shared governance. They can see our face. They can tell we're real people. We're not AI, we're not chatbots, and we care about them. We genuinely, authentically care about the nurses and how we can make their day better. And, the ones I've seen in the past, like, oh, I'm good, I've got this, I can do this all on my own, I've been doing this for 30 years on my own, I don't need you. They're the ones that are typically by the end of a week or so, like, you really need to use these guys. This is great. This is going to help you. And it's really—
I haven't seen that before, have we, Andy?
Maybe a couple times. Yeah.
Andy's got a couple nurse friends back at the
you have one so far. You have a whole team of them here.
Yeah.
But yeah, for sure, I think it's just kind of getting to know the program and realizing that it is a program for them to keep their burnouts lessened. And that's really at the end of the day what we want to do is keep our bedside nurses happy and at the bedside.
Well, and I think that's what I appreciate about the partnership with VirtuALly is that you guys are really on the same page with us. It's all about building relationships with folks in that facility.
Yes.
And that is key to success in these, especially in the rural markets.
100%. And I think, to your point earlier, it is somewhat new. I mean, virtual nursing in and of itself is maybe not new, but the way we're optimizing it is, and what we're doing every day, and the use cases we take on every day is a new situation. And the bedside staff doesn't want to feel like no one's listening to them and no one's taking their word for, into account. And that's what we do every day. So we have weekly meetings with them, quarterly meetings with them. They're constant contact with our staff. So it really is an extension of their team. It's not a separate partnership per se. We are very collaborative. My coordinators, my managers are in Epic chat every day. How are things going? How can we improve? And when they hear that, they almost take a big part of what we're doing in our program and look at it as their own. So, my virtual nurses is what they call it. My virtual nurse is going to help me today. It's not the virtual nurses or somebody from the outside. It's literally just like working in tandem together to make sure that everything is done within an acceptable amount of time and the patient ultimately is happier and safer.
Sure. Maybe speak to, some of the metrics or outcomes that you've had in terms of some of the programs just in, you referenced a couple different metrics, but I'm interested, maybe share in some of the large and small hospitals, some of the feedback that you've received as a result of the programs being in place.
For sure. I think the one that I have most pride in is the turnover rates that we're seeing consistently from both sides, either, kind of tertiary care centers or rural care centers. is, the program we've been in, the hospital we've been in the longest went from a 74% turnover rate to a 20% turnover rate. And I'm sure there was several things implemented in that time period, but what they contributed to is their support from VRN, which I think is really phenomenal.
Sure.
We also do documentation compliance. So we're in the charts, helping with those fall risk, helping with all the HAIs, everything of that nature. We have some data around being able to decrease that. Time given back to the nurses is about 120 minutes per shift per nurse, which is pretty exceptional. And so those are kind of the metrics I'm very proud of. What we're seeing now is also patient satisfaction is going up quite a bit, especially with the courtesy of admission nurse and timeliness of discharge, which of course rolls into throughput. So that's really important. And then nursing satisfaction's gone up. So we just heard back from one of our larger hospitals that said across the board, everywhere that virtual nursing is in that hospital, nursing satisfaction's gone up. And there's several comments wrapped around having that resource and support from the VRM program. And I mean, as you can imagine, nursing is on a time deficit, right? So as soon as that nurse clocks in that morning, they're probably about an hour behind. If you walk through the steps of everything a bedside nurse needs to do with the ratio of patients they have, and it's overwhelming. And that's why we're losing so many nurses. It's just at the end of the day, they don't feel like they're able to give the quality care to the patients they want to, and it's affecting their work-life balance. It's affecting their mentality. So that's why we're seeing all of these nurses leave. And our passion, and I know your passion, because I know you've talked about this as well, is keeping them at the bedside so they can take care of patients. Because regardless of all the AI that's coming in the virtual care, we still need that hands-on staff that wants to provide the care at the bedside.
Oh, for sure. For sure. And I think just the ability, I have to imagine that, you mentioned the reduction in turnover rates. So the retention is obviously improved. And we've seen that in other markets as well that have deployed virtual nursing services. But how about in terms of recruitment? So give me a sense of when you talk to hospitals and how, because a lot of our services, when it comes to physicians, we do a lot of work on the side with the hospitals in terms of recruiting physicians and how they can leverage these types of programs when they go to recruit.
Yeah.
So can you maybe shed some light on your experience that you've seen as a result of having the program in place, their ability to recruit, maybe some improvement on that front?
For sure. It is a very successful recruitment tool for many of our nurse leaders. What I would like to say is, especially in the rural areas, sometimes the vacancy rate is pretty high, and they tend to use a lot of contract labor because of the fact that they need those permanent positions placed. But if you can make the unit more desirable with VRN and virtual care, then those nurses will go to your hospital versus the hospital that has all of the bells and whistles and the technology and the resources that we provide. And therefore, you can kind of get those permanent positions placed and maybe not have to use as much contract labor as unless it's FMLA or something like that, how it was designed to use. But for sure, it's also kind of the cost of inaction if you're not careful and you don't have any virtual nursing program or any type of virtual care program, and the nurses have choices in a lot of these places, they're going to the hospital system that actually provides those resources for them. So we don't have the exact numbers on that. I do have several leaders that use this, and you can see it in LinkedIn and everywhere else that they bring on the VRN as a recruitment tool.
Sure. Well, I got to imagine, particularly if you're going into an environment that you're not familiar with, whether it's an emergency department and you've never worked ER, or an ICU and you've never worked ICU, or even med surge and some other areas that we're still working on in development, but assisting with OB and labor and delivery as another example of an area that's extremely difficult to recruit labor and delivery nurses in the rural hospitals and markets. So a way that we're trying to figure out to help sustain that is by offering obstetric support into those hospitals. And so I think the sky's the limit, really, where you start looking at these programs, but embracing these programs as part of your model in the hospitals, and the other beauty of this too, in terms of sustainability, I have to think that hospitals that have strong VRN programs in place, although, and to your point, the turnover rates are greatly reduced, and in many cases we've seen that, and the recruitment is easier. We've seen that. But the fact is, you'll still have some turnover periodically, and I have to imagine that it's sort of a little bit of an onus, or sleep easy sort of thing at night when you're the individual that oversees that unit or division, and know that you have the VRN team, despite losing a nurse that's going to go away in a couple of weeks or a month or whatever. And it just gives you that reassurance. You have support there for your local nurses that might be working a little extra for the time being. And then also helps with the recruitment strategy on that front. So you don't have to be as concerned about quality going down as much with that. But how about that type of perspective, Angel, when you're looking at programs? Give me an idea of something that maybe emerged that you weren't quite expecting when you move these programs in, and you started to see some of the benefits that we thought were going to happen, that you expected to see. What are some of the benefits that maybe you didn't expect, that some of the downstream benefits?
Oh, that's a good question. I think that the benefits we see kind of are the behind the curtain, maybe with our documentation compliance. We knew that we were kind of doing some chart checks and making sure that everything was great there, but there have been so many really great catches of how patients would have suffered in the long haul had our VRNs not caught it. And another thing I find that's really interesting, I'd love to do a paper on this, is how many SI patients are identified through our program. This is something else I didn't expect. You never want something lost in translation, that bedside care, that website care, to be lost because we're talking via technology versus I'm at the bedside speaking with you. But what we do find is, because of the focused care, our patients really divulge a lot of information to us. And oftentimes it's around mental health. And whether that's because they knew the nurse that was taking doing the intake, or simply just because it was just time spent eyeball to eyeball. Like we found so many SI patients that truly would have never gotten help in a minute, that they'd never told anybody. They didn't tell their wives. They'd never told anyone that they were struggling, and but felt motivated to tell us that, so that we can provide that care. So I think that truly is something that I find really intriguing. I thought maybe the geriatric population really wouldn't like the this type of model, this type of nursing care, but they tend to really enjoy it. Pediatric patients love it. Pediatric parents love it. They get more out of their discharges. They say that they've gotten, if they're frequent flyers, any of the other times, because once again, it's just the time allotted to focus in and spend that time with the patient family.
Right. Well, I mean, the bottom line is you give the bedside nurse, a little bit more free time to do more of the hands-on.
Right.
Which is what they want to be doing anyway.
Yep.
And it really sort of puts some guardrails around what the VRN's doing for you, and focuses them on providing that level of service that oftentimes a bedside nurse they struggle to do, just because of all the distractions. And you can call it sort of a de facto ADHD or whatever you want to call it. But there's just, to your point earlier, Angel, they're just pulled in so many different directions. It's hard to really just focus on it before all heck breaking loose in the middle of a conversation, and all of a sudden code blue down the hall or something like that. And you're off and running, and I didn't get all that discharge stuff done.
Yeah.
And
starting at 8 o'clock at night.
Right. So no, I agree. That's a great, and I got to tell you, that doesn't surprise me on the SI patients or the suicidal ideation patients, because, we see that, and in the rural markets frequently. I mean, healthcare workers, they're known people. People know these individuals, and they're not going to disclose everything. We see that a lot, even in our mental health triage program. Very similar. If they could pick off just one little aspect, and 99% of the time, what the social worker hears through that virtual conversation is different than what the local providers are hearing, just because of the relationships, right? So that typically that definitely makes sense. I think so. That's a great example. I think one other example is as you think about all of the years in a lot of these larger health systems, when you're talking, let's just bump it up a little bit in terms of size of facility, but maybe a little bit larger facilities that are struggling with a throughput problem out of the ICU or out of the med surge unit, or maybe out of step down units. And as you look at all the different aspects that they profile to try and figure out what is causing my throughput, what is my challenge, what's my roadblock, what's the barrier, and the way to leverage a VRN program to help mitigate that challenge is a very palatable answer in a lot of situations. And as you can attribute a lot of that to increasing the efficiency dramatically on the nursing side, can really help improve throughput in a lot of those challenges. And so building more rooms and adding more staff, which it doesn't exist, makes that difficult, right?
Mhm.
So I think this is another sort of a strategic way to look at this type of program beyond what was originally thought of when these programs were developed. What other benefits, Angel? As you talk to an organization or that's maybe contemplating this and thinking, "Golly, maybe this could work for us." And let's say I'm a chief nursing officer and I'm thinking, maybe I saw a presentation, I listened to this unbelievable podcast, and now, gosh, I think I should probably investigate something like this. Where do you think they should start, and what types of conversations should they start to have internally to consider this type of a program?
Yeah, I think that's a great question. I would start with their pain points, right? So what are they trying to solve? And because you don't want to throw the kitchen sink at it, right? You want this to be very defined of the KPIs you're looking for, what you're trying to solve, so we can work on those together. So, for example, if it's turnover, that makes a lot of sense to bring on a VRN program. If it's throughput, that makes a lot of sense. We can remote in, we can start the patient education on a mission like we all want to do, right? That's how we were taught to do. So by the time the patient leaves, they're thoroughly ready to go. They're being discharged, and they're probably not going to come back in 10 days, because they know everything they need to know. Their med rec is correct, everything of that matter. So throughput is one of those things. Also, just think that if it's burnout amongst your nurses, if it's patient satisfaction, if it's nurse satisfaction, you just kind of have to be honest about what your numbers are and look at them and say, what do we want to fix and how can VRN help? And honestly, because there's so many use cases and so many ways virtual care can help, we can just get in there with you and as a team find out the best way, best method for you. Is that an admission, discharge model? Is that a full care model? Do you need mentorship? Do you need code documentation? What keeps you awake at night, and how can we help you kind of mitigate those issues? So we do have an assessment tool that we can kind of go through with, and then each of those kind of has an ROI built into it. As you know, virtual nursing ROI is a tough conversation sometimes, but there are numbers associated with that. You have to also kind of look at your overtime, or your nurses spending a lot of time, documenting when they're supposed to be home. Is that something that will help? That has a number associated with, obviously. What we're seeing right now there are a lot of not only boarders in the EDs, but we're also seeing tons of patients, a large percentage of patients being discharged from from the emergency room, which is really tough because you're having emergency room nurse do a med surge discharge at that point, and it's just different, as we know.
I'm sure that goes well.
I know.
I was an ER nurse, and I can't imagine my discharge would have went real well. Yeah, I mean, and in most cases, they're not used to doing that anyway.
They're not used to it, right?
And so I can only imagine, the complications that ensue post discharge on somebody like that. And granted, it's probably a certain subset of patients, but nonetheless, fraught with issues, I would guess.
Absolutely. And the emergency room nurses, that's not what they want to do, nor are they really working at their top of scope. And then, of course, same thing with the med surge nurses. They're like, hey, I'm supposed to float down here and do this. However, this situation's set up, it's not good for anyone. But that's a perfect use case for VRN to come in and do a very thorough discharge for the patient, so that hopefully they're able to go home and heal and not bounce back to the emergency room, creating more problems, right? Creating more of that bottleneck situation. So I do think there is quite a bit there. But I would start with your pain points. Come to us. Let's walk it through. See what works for you. Oftentimes people want to start up their own virtual care program, and we completely understand that. Sometimes those are hard to scale though, because of the fact that you're pulling from the same resources that are already depleted. So it's not like you just have 40 extra nurses out there that just want to come into the system. And so it's really difficult to kind of scale those type of programs, but we're happy to help with any type of consulting piece of it too.
Yeah. No, I think that makes a lot of sense. And there's definitely, as you think about those conversations as an executive team and try to think through that, I certainly would recommend, bringing in some assistance and just helping to, if nothing else, just to think through that and give them some insight on some things to think about as you ponder a virtual nursing program. Even things as simple as technology. I say simple, it's not really simple, but what, to your point earlier, Angel, it's sometimes they need some help just trying to figure out what are they trying to accomplish, and many times they don't know what they actually could accomplish by having this as part of their wheelhouse. And so helping them walk through that could be a very helpful discussion for them and really open their eyes to the possibilities. And and then they can make some educated decisions on what they think is the best course of action for their organization, for sure.
For sure. And it's really interesting because not every bedside nurse makes a great virtual nurse, right?
No way.
There, I know it's completely. But yeah, I mean, we have built a VRN profile over all of these, almost 2 years now, just to make sure that they do come across as authentic and caring and compassionate. One, they have that technology etiquette that maybe bedside nurses aren't accustomed to, and that they're truly, able to kind of spend that time with not only the patient but the nurse, in both ways make them feel like we're all part of the same team doing the same goal. So it is a learning curve for some bedside nurses, but you just have to find the right fit for them.
Yeah. Well, for sure. And I can't emphasize enough. And that's one of the things that we definitely appreciate about the VirtuALly team is their focus on that in terms of the VRN and what the VRN should be, and sort of that skill set. And cannot agree with you more that you just can't put anybody on screen. It doesn't work that way. Same thing with physicians. A jerk on the screen is going to get jerk results, whether they're in person or on screen, doesn't matter. You're going to get jerk results.
True.
And so, unfortunately, then you got to deal with it, and it's tough to accomplish your goals if that's what you're dealing with. So certainly, and the beauty of this is it really gives you the flexibility based on your model to bring nurses into the system that really meet those qualifications, versus if you're going to shoehorn it into a bricks and mortar building in a specific location that people have to come to on a daily basis. So it really limits your pool of applicants, for sure, for that type of role.
And if they're accessible, the bedside's going to pull them, right? So if they're just down the hall, it's really easy to go grab Shane and say, okay, I need you in this room with me. We need to do hands-on this patient. When they're a new resource and it's a net new resource for the team, they look at that a different way. Then why isn't Shane on the floor today? Why does he get to be the VR today?
Right.
I want to be the VR. So you do have to, you kind of have to be mindful of that. But also what the team can look at it as, if you are utilizing your own nurses, is this isn't a huge help. Really, you're just kind of diluting what we have and maybe doing it a different way. But at the end of the day, I don't have any net new help. I'm not really getting true resources. And so that works having, purchase labor that you actually have them able to come in and just take that off their hands so that they can do those, kind of work to the top of their license.
Yeah, certainly. Yeah. I mean, all in all, the recruitment is a big deal, and helping to profile all the different nursing staff is a big deal. And as we talked earlier, diversifying the skill sets of the virtual nurses that are available to a given facility is a big deal. So even if, those internal programs you referenced earlier, if you think about, I know if I was in a large health system that was going to build out its own internal program, and thinking about, the virtual nurses that I'm going to put on, and you're dealing with your subset of nurses that you've employed in your facility, you're going to have a handful of them raising their hands wanting to do it, and probably 50% of them you don't want to put on screen, give or take.
Yeah.
And then there's 20% you'd really love to have on screen that don't want to do it. And so then forcing somebody to do it who doesn't want to is a challenge. I mean, there's all kinds of challenges with it. So really working with a partner on this that can help augment your local staff and sort of offload that and ensure the nurses coming on have a quality skill set, a diverse skill set, and a great website manner is fantastic. And it's such a huge value add for sure. Well, listen, Angel, this conversation has been great, and I really appreciate your time today in working through what the VRN program has done so far and will continue to do moving forward. And I know we will be having a follow-up webinar, or excuse me, a podcast rather on, well, in fact, I think we're doing a webinar as well.
We are.
Right? And
Yep.
So stay tuned on the dates for the webinar, which will be coming out here soon. But we will be having a follow-up podcast on the virtual assisted sitting or monitoring, along with AI and involvement in that as well. So that'll be another great conversation coming up here in the next few months. So stay tuned for that as well. So, Angel, any parting thoughts that you have as it relates to the VRN program?
Yeah, I would just say, don't let the cost of inaction slow you down. Don't look for perfection in this. Start somewhere, even if it's small, 1-2 nurses, and just, kind of just build from there, because this isn't slowing down. This is the evolution of healthcare. So it's the only way that we can survive healthcare. So let's, just get together. We're happy to help and support in any way. I will say, as far as the sitting side of it that we're looking forward to, we've actually been doing this since 2017 within the Institution of Medical University of South Carolina. And so we're highly resourced there. And we've heard all about the technology and the AI that's coming. And we're being bullish about it, embracing it, but making sure that we're vetting it and that we're the ones running the AI versus the AI running us. So I'm really excited for that conversation so we can kind of walk through some of that.
Yeah, that's perfect. They're still looking for an AI to run me, so they're looking for that. They're struggling to find it, but they've been working on it for sure.
Well, it's machine learning, and you're such a wild card. I don't know they're going to get there, but we can always try.
There's smoke involved, I think. I don't know.
Yeah.
The machines are they're struggling. But no, it's been great to spend some time with you on our podcast today. Really appreciate your time, and on behalf of all of our clients and patients and soon to be clients that are using virtual nursing, thank you for all your service, and looking forward to the evolution of this program in the market for sure. So thank you again for spending some time with us today.
Oh, thank you. It's been wonderful. Appreciate you.
We would like to thank you for joining us today. Our promise to you, the listener, you will be inspired or at a minimum find value in the information shared in this podcast. Please offer a comment or offer feedback so that we can improve this podcast and better meet your needs. Please remember to share this podcast with others that you feel may get value out of this by listening. And it's always helpful to subscribe to the podcast channel so that you're aware of future episodes and releases. In addition, if there is a rural health topic you would like to have covered on this podcast, please leave us a comment, or you can send an email to pulse@teledigmhealth.com. That's pulse@teledigmhealth.com. For more information or general inquiries, please visit teledigmhealth.com.